Buenas tardes a todos. Soy Patti Sánchez Bao, oficial senior de salud global de la Fundación de
Good
las Naciones.
afternoon, Patti. I am Patti Sanchez from the United Nations, and I'm the chairman for today's forum. On behalf of the Directing Council of the Initiative Champions Against Malaria in the Americas, I would like to welcome you to the celebration of Malaria Day in the Americas 2022 to achieve the goal of zero malaria. Before we begin, I would like to mention the options of the Zoom platform available for this event. We have interpretation in Spanish, French, English, and Portuguese. To hear the event in the language of your choice, click the icon of the Earth at the bottom of your screen. Please use the chat of the event to send questions or comments. All participants are muted. The event organizers will open the microphone when necessary to give the floor to the participants. Dear friends, today, the Board of Directors of the Initiative Champions Against Malaria in the Americas, together with the countries of the region, has carried out a review of the initiative, considering the plan of action for the elimination of malaria 2021-2025, to respond better to the current challenges and future challenges of the region. We'll hear more about this process later, and hopefully this reconsideration of the initiative will inspire interested parties and partners to become champions for the elimination of malaria. We'll begin our forum with the welcoming remarks from Dr. Massimo Bidelli, Interim Director of the Communicable Diseases and Environmental Health Determinants of the Pan American Health Organization, followed by remarks from the Directing Council of the Initiative Champions Against Malaria. And then we'll hear a presentation from the Regional Advisor of Malaria in Pajo about the importance of prioritizing the elimination of this disease in the current context and the challenges the countries of the region still face after almost 3 years of the pandemic. And then we'll hear a commemorative video of the 13 years of the initiative Champions Against Malaria in the Americas, followed by a presentation on the process of the initiative and comments from some of the countries that have participated in the process. And lastly, we'd like to congratulate Belize for achieving and maintaining the goal of zero malaria in the last 3 years. We'll conclude the forum with a video on how the vector control program from the Health and Welfare Ministry of Belize is working to maintain zero malaria and become the next countries of the Americas who will be certified malaria-free by the World Health Organization. With no further ado, I would like to invite Dr. Massimo Chirinelli, who Interim Director of Communicable Diseases and Environmental Health Determinants in Pajo, to make his welcoming remarks. Dr. Chirinelli, you have the floor.
Thank you very much, Ms. Sanchez, and a very warm good afternoon to all of you in attendance. It is my pleasure and honor on behalf of the Pajo's director, Dr. Carissa Etienne, to welcome all of you to this virtual event to commemorate the 16th annual Malaria Day in the Americas, a well-established ceremony that comes every year today, and also happens to occur within the context, and you can see that probably from some of the Pajo's background, the recurrence of the 120 symbol, because it is this year exactly 120 years since the foundation of the organization. And let me remind you that one of the main reasons for them to establish this, the oldest public health agency in the world, was exactly to combating malaria, which at the time was really ravaging some of the countries, and it was still endemic in many countries in the region. So the response to malaria, and these days its elimination, has been in the working agenda of Pajo since. However, in the last 2.5, almost 3 years, we also had to go and sail through the pandemic, which, as we all know, has put a very heavy impact on health systems, and at the same time brought up a number of new challenges. However, our commitment and our determination to continue and move ahead towards the elimination of malaria has not changed. I would rather say it has come even stronger than it was before the onset of the COVID-19 pandemic. And we put malaria elimination as one of the candidates in a much broader corporate effort that the agency is pushing for the elimination of a large number of communicable diseases and their consequences out of the region of the Americas. The good news is that over the last 5 years, the World Health Organization has really certified a number of countries, 3 countries in the region of the Americas, as malaria-free, including Argentina, El Salvador, and Paraguay. Moreover, we do have very good perspectives that Belize, since 2021, has been reporting, and consistently over the following years, 0 new cases of malaria, which leads us to think that next year there might be all conditions for Belize to be certified and then be declared malaria-free by WHO. In parallel, we do also have another number of countries which are moving ahead in the same direction, and we anticipate that probably more countries might reach the club of malaria-free environment in the region by 2025. These are the good news, but on the other side, we also have to take note that after achieving a significant reduction in the transmission and new cases of malaria since 2010, we have also to register a significant increase in the number of new cases between 2014 and 2019. And the situation has got even a bit worse in 2020 and 21. And so we have sort of a mixed picture emerging, most of it due to the impact of the malaria elimination related activities, which in turn were activities affected by the impact of the pandemic, sorry. The numbers are documenting this trend. The region has reported altogether an overall 32% reduction of cases in 22 compared to 2019. And it's a little bit of a blurred picture, the one that we have in front of us, with some difficulties to properly understand and justify and explain all these conflicting numbers, data, and messages. Countries have no doubt responded to adjust and adapt to the new situation, but a number of challenges are still in place. And with the return to pre-pandemic levels of activities and economic activities, that has also brought a renewed resurgence of migration and high mobility. And we all know that for the Americans to remain on track with malaria elimination targets, countries must tailor and sustain intervention based on local data and disease trends. So, and this is one of the efforts that we're currently confronted with, how to maintain clarity about these trends in presence of conflicting data and information arising. To that regard, we believe that context is everything, and that has to be maintained prominent when it comes to thinking and planning about malaria elimination. Broad brush initiatives have constantly failed to take into consideration factors such as rural population and migration, which we know in turn are very important drivers of the disease. Economic migration from endemic areas is a huge driver of malaria in our region, as we all know by hard experience that mosquitoes do not know and do not recognize borders. Elimination can therefore be only achieved in the Americas when every country participates and consolidates efforts towards achieving the common goal, common target of zero malaria. Countries also must continue to work across all sectors, as malaria is not just a health issue, but it is a condition that requires attention from the economic, financial, labor, the environment, and many other sectors of our societies. I will not elaborate more about collaboration and partnerships, but this is definitely best demonstrated in words, but in action. The commemoration of Malaria Day in the Americas, as it has been the case over the last 16 years, is our humble demonstration that collaboration in action is a fact. And let me take the opportunity to acknowledge and thank the partners that accompany all our efforts, that have accompanied all our efforts during these years, starting with the UN Foundation that we have seen already in the opening of this ceremony, the George Washington University Milken Institute School of Public Health, the Johns Hopkins Center for Communication Program, the Global Health Consortium at the Stanford College of Public Health and Social Work in the Florida International University, the American Society of Tropical Medicine and Hygiene, and the United States Agency for International Development, USAID. This is a block of partners that bring into practice what we can do together. We're very much honored and pleased to virtually convene and host all of you today. We hope that this will be an enriching afternoon for you as much as it is for us. Once again, welcome. Thank you very much, and let's do it together. Over to you.
Muchas gracias, doctor Gidnelli, por sus palabras. A continuación, quisiera invitar al doctor Kumar Nirvi de la Escuela de Salud Pública del Instituto Milken de la Universidad de George Washington a brindarnos unas palabras. Por favor, doctor Kumar.
Good afternoon. I am Nirvi Kumar, as Patty mentioned. I'm professor of global health at the George Washington University, Milken Institute School of Public Health. And I've had the honor as well as pleasure of serving as chair of the Malaria Day and Malaria Champions Secretariat for the last few years. And I bring greetings of Dr. Len Goldman, who is the dean of the school, as well as Dr. James Tilch, who is the former chair of the Secretariat. GW School of Public Health is only a few blocks away from PAHO, and we are absolutely delighted to be partner on since the beginning, since the inception of this initiative. And we look forward to much stronger partnership and achievements as were highlighted by Dr. Gidnelli. I'm delighted to note that we are currently on year 16th of Malaria Day in the Americas and on year 14 of Malaria Champions in the Americas. This year, the Malaria Champions Committee has reviewed the initiative to better respond to current and future challenges, taking into account the new plan of action for the elimination of malaria between 2021 and 2025. The need to promote greater appropriations by the ministries of health and other actors in the countries, as well as greater use of the potential of social network, and the need for more permanent actions, among other aspects, have motivated these revisions in our action plan. The Malaria Champions Initiative will continue to evaluate all entities, countries, provinces, municipalities, implementing best practices for their recognition, acknowledging that in any given year, there might be more than one team and more than one champion. Progress against malaria will depend upon strong health systems that are adequately funded and equipped to deliver quality health care to all who are affected. The world still continues to struggle and deal with the ongoing COVID-19 pandemic, and not to mention the ongoing issues with monkeypox and Ebola in certain parts of the world. So we are continuously challenged by infectious diseases, and malaria, of course, remains one of the ancient public health problems. Late last year, the World Health Organization actually approved the very first ever malaria vaccine in the world. The vaccine is not perfect, but at least it provides 30 to 40% protection for a short time. I'm aware of the work done by many of you, and I've acknowledged and I've witnessed for the last several years the progress that has been made by numerous PAHO countries, and I look forward to even greater success in the years to come. In the last few seconds, infectious diseases continue to challenge all of us, and we cannot risk gaining the momentum that we have gained. Losing the momentum that we have gained over the past decade. Because You know as well as I know that the malaria elimination task is not complete unless it's really completed. We are encouraged by the recent progress, and I just want to re-stress that while it may appear that malaria may be easily eliminated, however, you know that it remains a pretty daunting task, and your efforts are certainly laudable. I extend my personal congratulations to all of you and your efforts and achievements, and continue to motivate others all over the world. Finally, just a word for the GW School of Public Health. We are a recognized leader in research and education, and we have ongoing active research programs focusing on the development of malaria vaccines and malaria diagnostics. And if any of you need to establish partnership, we look forward to establishing those partnerships. So we commit our experience in addressing some of the most important public health challenges of our times. Malaria is certainly one of them, and we are glad to welcome you all here today. Patty?
Muchas gracias, Dr. Kumar, por
Thank you very much, Dr. Kumar, for your kind words. Very inspiring. And to hear that GW is open to establishing partnerships with others to continue to move forward towards the zero malaria goal. And now I'd like to invite Dr. Cecilia Munagabashat, Director of the United Nations in Global Health, to say a few words. Cecilia, please. Thank you very much, and good afternoon. It is an honor to celebrate with you the 16th Malaria Day in the Americas, and we recognize the incredible progress attained thanks to the resilience of the malaria programs in the region, particularly during these difficult times of the pandemic. And now more than ever, those programs and the health workers who make them operable have become champions in this fight against malaria, and their work has inspired all of us who are committed to eliminating malaria in the Americas. The Malaria Day in the Americas is a wonderful opportunity for us to work together with the communities, the countries in the region to strengthen our knowledge and reinforce our commitment to achieve health systems that will help us achieve the zero malaria goal. In the last 20 years, there have been extraordinary achievements in the fight against malaria. More than 10 million lives have been saved, and the world mortality due to this disease has dropped in more than 57%. In the Americas, many countries have managed to reduce malaria in more than 75%. And in recent years, we've seen El Salvador, Argentina, and Paraguay have reached the elimination of malaria. However, progress as a whole has stopped since 2015. Some countries, especially those who have conflicts or weaknesses, are seeing an increase in transmission and outbreaks of malaria. The COVID-19 pandemic continues to threaten us worldwide. According to WHO, a third of the countries of the world have experienced interruptions, at least partially, in their health services against malaria as a result of the pandemic. Under these circumstances, many countries have managed to implement actions to maintain their diagnostic treatment and efforts of malaria with the technical guide of PAHO and WHO. The fight against malaria has shown that even in critical situations, we can offer effective interventions when and where they're needed and guarantee access to reliable information to continue with the surveillance system. Today, we must redouble our efforts to begin with our commitment assumed in 2015 of eradicating malaria from the world by 2040. Governance and response to malaria is essential, together with our commitment and participation of communities affected. For over 16 years, the United Nations Foundation has defended the commitment so that no one dies of malaria, and the need to mobilize resources in keeping with the challenge so that we can see a future free of malaria. We're proud to be able to work together with PAHO and other strategic partners so that we can achieve this vision. Thank you very much. Thank you, Cecilia, for your kind words and reminding us that it all depends on the country's commitment as well as of all the communities so that we can achieve the zero malaria goal. I'd now like to invite Mrs. Gabrielle Hunter from the Communication Center Program from the Hygiene and Public Health Center from Johns Hopkins University to say a few words. Gabrielle?
Thank you, Patty. Good afternoon, and thank you all for joining us on this important occasion to commemorate Malaria Day in the Americas. I'd also like to extend a very big thank you to the wonderful team at PAHO for organizing today's ceremony. My name is Gabrielle Hunter, and on behalf of the Center for Communication Programs at Johns Hopkins University. It's a pleasure to welcome all of you today. The Center for Communication Programs has been proud to partner with PAHO and the other members of the Malaria Champions of the Americas Committee for 10 years now. We see this work as vital to keeping the Americas region on target for elimination of malaria and to maintain momentum even in the face of many challenges. An important theme that we will discuss today is greater localization and tailoring of our work. The WHO updated malaria strategy emphasizes the need for carefully tailored prevention, diagnostic, and treatment approaches, informed by local data and disease patterns. This means tailoring responses to the local setting. Can we identify where and among which populations malaria is most concentrated? How is malaria moving around the region? Where are we dealing with falciparum, vivax, both? And what about the type of mosquito vector? What are its biting, resting, and breeding behaviors within a specific area? Tailored programs will take these and other factors into account to meet people where they are with the prevention and treatment tools they need. And local data is critical to get us there. So as we discuss localized efforts during today's ceremony, I hope that we may all come out with renewed passion, commitment, and new ideas to reach zero malaria in our region. Thank you and look forward to the deliberations today.
Muchas gracias,
Thank
Gabriel.
you very much, specifically for reminding us of the importance of adapting the response to malaria to the local environment so that we can actually make use of these strategies and reach the zero goal. And now I'd like to invite Dr. Carlos Espinal from the Robert Stanford University, from the International University of Florida. Thank you, Dr. Espinal. And he is muted. I'm sorry, but Dr. Espinal is muted. Patricia, thank you very much for the honor of being here with you, and thanks to all the distinguished colleagues from the Pan American Health Organization and our colleagues from the Malaria Champions of the Americas, as well as the participants. I would like to briefly reaffirm our commitment from the Florida University and the Global Health and the Consortium of Global Health with the Malaria Champions Initiative and the Zero Malaria or its elimination in the Americas. I want to congratulate the countries who have had the strength to maintain their activities despite the negative impact of COVID-19, not only in the malaria work, but in the whole structure of the health systems. We have enormous challenges today, including the one we've mentioned of the displacement of populations and the growing and disorderly migration that's affecting any program, not just the malaria program, but any of the health programs in matters of prevention, treatment, diagnosis, or community participation, be it due to violence affecting us, the inequalities, and the impact of COVID, as I mentioned. But aside from that, we have a very, very serious threat, which is the economic crisis that we're facing, which is coming upon us with a tremendous inflation, the devaluation, which will, I'm sure, affect the health budgets of the country. So this is an urgent calling to the countries to maintain the investment in the elimination, seeing it as an investment in health and welfare, and not as an expense in the health priorities, and that they maintain that investment so that we can continue with these programs. There's also a new order which will be a key challenge, which is the development of the activities on the new post-COVID order. And what's this going to be like? We're just beginning to recover from this, and we really are not quite sure where we're going. whether COVID has ended, what's been the impact of this on the national programs and on the public health strategies. So all of these challenges make it important for us to think in an innovative and creative way, maybe reassessing the human talent that we have so that we can adapt to these new circumstances. And once again, my congratulations to the Pan American Health Organization and to the countries for their continuous effort, and the commitment of our university, FIU, is in all the activities that we'll continue to do together. Thank you very much. Thank you, Dr. Espinal, for reminding us that health is first and that it's not just something we talk about, it's that we must continue to reinforce so that we can achieve these programs. I'd now like to invite Mrs. Heidi Min from the Health Office for Latin America and the Caribbean from the United States Agency for International Development, the USAID. Mrs. Heidi, can you take the floor?
Thank you so much, Patricia. Good afternoon. On behalf of USAID, I'm really honored to be a part of this event, this special day to recognize the 16th Malaria Day in the Americas. Preventing and controlling malaria remains a top priority for USAID, and we are so proud to continue to support malaria efforts in the region in partnership with PAHO and with other key stakeholders and countries, as we have done for close to 3 decades now, and here in the Americas, especially with a clear focus on elimination. As my colleagues have stated, the Americas have made commendable progress in the effort to respond to malaria since the start of the 21st century, especially thanks to the mobilization of country resources, community-based approaches, and multi-stakeholder partnerships, which is kind of what we're seeing here today. But most importantly, USAID recognizes the leadership of countries in the region to help advance elimination. But as others have stated, we also recognize that this progress is under threat as countries are facing unprecedented challenges due to the strain on health systems caused by the COVID-19 pandemic, climate change, increased migration across the region, and the economic downturns that drive increased land use change for things like mining and agriculture that create new vector breeding grounds. So in face of these challenges, we especially appreciate the commitment of all of you, and especially at the country level, to remain on track for malaria elimination. And we look forward to continue supporting key partners to improve approaches for malaria diagnosis, treatment, vector control, and surveillance for even greater impact. You know, in many countries, as malaria becomes more and more focalized, many of the remaining cases are occurring in underserved and hard to reach vulnerable populations, such as indigenous groups, miners, loggers, and other poor and rural populations who often lack access to healthcare for financial, geographic, and cultural reasons. And again, all of these reasons and factors have been exacerbated by the challenges of the pandemic and beyond. So we as a region together need to work to bring attention to and find ways to address these inequalities and develop those innovative approaches, as my colleague just mentioned, to reach these populations. And as others have stated, the USAID is really committed to supporting tailoring interventions and seeing that as one of the answers to ensuring that responses are appropriate and include analysis of the local epidemiology of malaria to determine the most effective set of interventions for each setting, and taking into account the larger context in which these cases are taking place, and developing the evidence necessary for the informed selection of approaches. And at the end of the day, the most important thing is implementing and success in implementing the selected approaches, increasing and improving and supporting countries to have the capacity to implement these tailored approaches. We believe the experience of malaria in the Americas represents an important opportunity, not only within the region, but for the whole world to see how and learn from countries in the Americas on how they are overcoming the challenges of elimination and documenting best practices. And we look forward to continue to working with all of you and with PAHO and other key partners to move this forward. we know that malaria can sometimes be a little lonely, as especially in countries there are so many competing health priorities and other types of priorities. But we hope that those of you who might feel that way can come together on this special day and during the special celebration of Malaria Day in the Americas and recognize that you are not alone. You have a huge community of malaria champions here in the Americas. And we are really proud to support you and to work together until we reach zero malaria in the region. Thank you so much.
Muchas gracias, señor Heidi, por
Thank you
los
very much, Heidi, for these comments and for showing the commitment that the agency has towards the region and towards health in the region, as well as the focus that we ought to maintain with the underserved and vulnerable populations. And now we'd like to welcome Dr. Roberto Montayo, Regional Advisor of the Malaria Program of PAHO, who will be offering a presentation about the importance of prioritizing the elimination of malaria in the current context and the challenges that are still faced by countries in the region almost 3 years after the pandemic. Dr. Montoya, you have the floor. Thank you very much, Patricia. It is a pleasure to be with all of you today. We are very grateful, as always, for the participation and the permanent support of the partners who are with us today. Today, which is the Day of Malaria in the Americas, is celebrated every year. It is the target of many attention, and a lot of importance is being given in PAHO. It is a time in which we share experiences and achievements, and we celebrate these, but it is also a time in which we always consider challenges. Every country with the partners who are with us in this fight against malaria, and I will talk about the challenges that we still face. And before I begin, as we should mention today, this year, when PAHO celebrates 120 years of joint work that is being done, the important presence of malaria at different times, with this timeline that you can see from the very beginning, when Dr. Giovanelli began with the fight against tropical diseases in the Panama Canal, and after that, the eradication campaign. And throughout all these years, the joint work that was done by countries in malaria has been kept, and that is why it is so important to commemorate this date that we're doing today in order to strengthen this work that is being done jointly with all the stakeholders in the region. In order to illustrate the current situation, you can see here the most current data on malaria for 2021. Countries have reported this. We had an approximate total of 520,000 cases of malaria in the region, which implies a drop, a reduction when compared to 2019. That important peak that we had for 2 years, 2017 to 2019. In 2019, but it is still an increase in malaria. So we're facing an increase in the number of cases of malaria of 8% when compared to the baseline of the Global Technical Strategy and our Plan of Action, which is 2015. So the challenge continues to be huge for countries to revert this trend and to avoid malaria. This behavior that we've seen in recent years, as it was well said by Dr. Vidente, was impacted by COVID, restrictions in movement, which impacted malaria in a way. But at the same time, in all countries, there was an impact in the provision of services and access to diagnosis, vector control, and services. So 2021, 22 have been seen with a permanent challenge for the region. In order to comply with these two global goals to which we have to contribute as a continent, the elimination of malaria in countries and reducing transmission. And the region has made huge achievements in elimination. You're very well acquainted with this. This is information regarding the 3 countries that have been certified as malaria-free in recent years. And currently, Belize, who completed already 3 years without reporting cases. So it is in the process of being certified as malaria-free by the World Health Organization. And it is not only these countries, there are other countries that continue moving forward towards elimination. It is almost like within this group of countries that WHO believes can eliminate malaria by 2025. And in this group, we found 10 countries that belong to the Americas, because in 2019, they had less than 2,000 cases of malaria. And they were in a very favorable situation regarding elimination. And some of these countries, unfortunately, in the last 2 years, have seen an increase in the number of cases. And others continue to see a drop in these numbers. However, this entire group of countries has a potential of eliminating malaria in the coming years if we continue working closely with them, as well as with other partners, particularly Central America. The REM initiative, which encompasses many other regional countries in that joint work in order to eliminate malaria in Central America. So it is thus that we have the situation. So we have a group of countries with a significant drop when we compare the data for 2021 with the data for 2015. You can see these bars which show proportions. It is a percentage of a reduction or increase in malaria compared to the baseline that we have for 2015. So countries with a significant reduction. You can see here some that are approaching the goal of 75% reduction by 2025. But another group of countries where the increase has been quite significant. So you see these bars that show significant increases, which includes countries such as Costa Rica, where they show a huge bar. But in fact, in numbers, it is still very low. And it is a country that is very close to eliminating malaria, as well as seeing other countries that also have the potential to eliminate this in the coming years. But there are other countries where we see a huge burden with a significant increase in the number of cases. The situation in Venezuela, in Colombia, countries in the Amazon region, Nicaragua, Central America, have seen an increase in the number of cases in recent years and continue to be a huge challenge. And behind the situation and these numbers, we find the realities that we see in the countries. That this is the dwelling of a person, maybe a family. The picture was taken by us in a municipality, and those that have the highest level of malaria in a country in Central America, in the region. And I believe that this is what we have to understand, what lies behind this entire situation with the malaria. And that is why it is so important to see the type of joint work that we celebrate today, and that has to be further promoted. It is important to ponder upon these determinants, and it is within this context that in our plan, we are developing the Regional Plan of Action 2021-2025 that is currently being implemented, which includes the main pillars giving importance to elimination with concrete changes, and this is being done jointly with other partners in the region. And it does play an important role, the elements of this plan, where no doubt we see these initiatives that call upon us today, Malaria Day and the initiative of Malaria Champions. And I do want to stress in that plan of action 2 main elements for change. And I will describe these in the coming slides. This idea of massifying access to diagnosis and treatment. This means that we have to reach all the communities. It means that we should not have any barriers, any hurdles to have access to diagnosis. When a person has to go through the river in the Amazon in order to have access to diagnosis and the treatment to malaria, could be sufficient reason so as not to come back. So the challenge is huge, because the challenge is to include the diagnosis and the treatment as close as possible to all the communities. And malaria does have a highly effective treatment. And if we do have very simple diagnostic elements and with very good performance, so it is a matter of having concrete actions. Nowadays, we still face a huge gap, but to maximize the use of technologies available, RDTs with an extraordinary technology, but the region continues to use in a suboptimal way. They have significant defects, but they show a huge potential in order to bring diagnosis and treatment to the communities, offer medicines and treatment to the communities without any hurdles. It is unacceptable that we'd have healthy units in malaria areas that don't have a diagnosis because they don't have microscopes at a time when we have rapid tests in order to diagnose and treat malaria, to involve ambitiously many other stakeholders in the community, to increase, to step up the needs and what has to be implemented regarding community participation. Then these are concrete actions, and we are faced with a challenge. In the last few years, we've disseminated the DTR strategy, and this has to do with massifying much more the initial RDT in order to have a diagnosis without any hurdles to be used in the different communities in the region. And this goes hand in hand with this concept of consolidating our malaria-free micro-territories. This is an elimination plan. It is not control plans. So we have to consolidate territories without malaria. We have to make sure that the entire area and the municipalities is malaria-free, and then the province and the municipality throughout the entire country. And that is why we face this need of addressing malaria at a local level. And that is why this slogan that we want to disseminate today of adapting our responses to the local context. It's already been mentioned by the previous speakers. And therefore, this is such an important strategy in understanding malaria at a local level in a micro area. We have to organize local teams in order to be able to achieve that impact of having malaria-free territories. And undoubtedly, regarding multi-sectoral participation, a year ago in this celebration, we promoted with a lot of emphasis at this issue. And we have to continue promoting this because the gap that we have in implementing this is huge. Behind malaria, we find a whole set of economic and social factors that lie behind this as well as stakeholders involved. And we have a huge number of lost opportunities, missed opportunities regarding what we can do with a much more intersectoral approach. This is what today is all about. This is what this celebration is about, the celebration that we've been doing for 13 years. And that is precisely what this initiative is all about, the Malaria Champions of the Americas initiative. Throughout all these years, it's been acknowledging achievements and also encouraging others in order to address the fight against malaria. Currently, when faced with all these challenges that have been described, we need to consider how to reorient this in order to have a greater impact and to be able to revert these trends and to consolidate the achievements that have already been made. We want to talk about this later on in this celebration. How can we reorient, re-guide, and strengthen these initiatives and this joint work with many stakeholders all together with the countries in the region in connection with the elimination of malaria? Thank you very much. And back to you, Patricia. Thank you. Thank you very much, Roberto, for this excellent presentation, which enables us to see how we're doing currently in terms of the trend of this disease in the region, and what are the alternatives, or what are the options in order to reach zero malaria. Now I'd like to invite you to see a video that was prepared by our PAHO colleagues in connection with the 13 years of this initiative, Malaria Champions in the Americas.
¿Qué define a un campeón? ¿Es aquel quien llega a una meta de primero o aquel para el cual esa meta es solo el punto de partida de muchas más? ¿Es un campeón egoísta o sus sacrificios, perseverancia, convicciones, dudas y triunfos son para inspirar y compartir con los demás? ¿Se retira un campeón ante la primera dificultad o enfrenta cada adversidad, se levanta y continúa el camino porque sabe que en su esfuerzo estamos todos los que creemos en él? Un campeón es todo eso: inspiración, sacrificio, perseverancia, creer, compartir, humildad. Un campeón frente a todas las adversidades llega a la meta para volver a empezar. Con una idea visionaria y frente a la urgencia de hacer frente a la malaria, nace en el 2009 la iniciativa Campeones de la Malaria en las Américas. Su objetivo es identificar y honrar los esfuerzos innovadores que han contribuido significativamente a superar los desafíos de la malaria en la región. Al mismo tiempo, continuar apoyando el trabajo de campeones anónimos que creen que esa línea que divide a los que tienen y los que no se puede borrar. Por 13 años, y bajo diferentes temas, en las comunidades más remotas, en circunstancias adversas, la Organización Panamericana de la Salud fue testigo del trabajo y sacrificio de verdaderos campeones. Se estima que más de 100 comunidades de 15 países de la región han sido impactadas positivamente, directa e indirectamente, por esta iniciativa. Esta es su historia. 2009. Superando los desafíos de la malaria en las Américas. 2010. Enfoques innovadores para llegar a los grupos de alto riesgo de malaria. 2011. Fortalecimiento de los elementos de apoyo para superar los desafíos de la malaria. 2012. Mejores prácticas en el diagnóstico, las pruebas, el tratamiento y la vigilancia de la malaria. 2013. Esfuerzos integrados contra la malaria para lograr objetivos clave. 2014. Mejora de la gestión integrada de vectores para prevenir la malaria. 2015. Esfuerzos contra la malaria que contribuyen al logro de los Objetivos de Desarrollo Sostenible. 2016. Esfuerzos contra la malaria que contribuyen a la eliminación de la transmisión local de malaria. 2017. Esfuerzos contra la malaria que contribuyen al acceso universal. 2018. Esfuerzos contra la malaria que contribuyen a fortalecer el sistema de salud. 2019. Esfuerzos de los municipios de alta carga para reducir la transmisión de la malaria. 2020. Mejores prácticas en paludismo en municipios de alta carga durante la pandemia de COVID-19. 2021. Municipios de alta carga con carga reducida de malaria. La iniciativa Campeones de Malaria en las Américas ha estimulado los éxitos de los programas de control de la malaria en la región y preparado el camino para los próximos pasos. Los que continúan en esta tarea pueden avanzar firmes, seguros y confiados de que en la marcha encontrarán otros campeones, otros héroes anónimos, para juntos crear más comunidades libres de malaria. La Organización Panamericana de la Salud reconoce y honra la invaluable labor y dedicación de los campeones de malaria en las Américas en su incansable tarea de construir comunidades libres de malaria.
Realmente un video bastante emocionante.
Truly a very exciting video, particularly for all those who are participating here, connected from different countries in the region. It is unbelievable what we've done in the last 13 years. Now let us welcome Dr. Alexandra for the Attention for the Prevention of the Elimination of Malaria, who will talk about the process of this initiative. Dr. Alexander, you are recognized. Thank you very much, Patricia. I will present my screen. Let me just show my screen now. Thank you very much. Good morning, and thank you, everyone. Dear partners and colleagues from the countries for participating today, and thank you to all those who are following us with the different YouTube channels. In this 16th celebration, 16th Malaria Day in the Americas. So thank you very much to our colleagues who've prepared this video, this historic video of the 13 years of Malaria Champions in the Americas. As we just saw on the other video, this initiative of Malaria Champions in the Americas has been deploying innovative efforts that have contributed to overcome the challenges of malaria in the region. The implementers have been recognized and acknowledged, just giving the methods and the models to be followed in implementing the fight against malaria. At the same time, the initiative has provided greater opportunities in order to promote a greater appropriation and contribute to grow in the technical cooperation. However, in order to better respond to current and future challenges, taking into account the new plan and action for the elimination of malaria 2021-2025, the Committee of Malaria Champions has considered it necessary to review the initiative so that, amongst other changes, we can promote a greater appropriation by the ministries of health, as well as other stakeholders in the countries, for more sustained actions to encourage greater diversity of champions, as long as we support the implementation of malaria implementation plans in the countries for the elimination of malaria. These plans also bring ideas in order to make better use of the potential of social networks with a broad use of information documenting the successful experiences. It is within this context, and after several meetings of the Committee of Champions for Malaria in order to develop a schedule for the elimination in May, June this year for Malaria Champions Committee, we organized a session in June to develop a strategy that will take into account the views of countries. Around 120 participants, including national partners, former malaria champions, officers of the malaria programs, and cooperators, both at an international as well as at local level, participating in this consultation. In August, we prepared a report of these consultations that was submitted to the committee, which was used as a basis for the development of a concept note between September and October, which we are presenting today. This concept note emphasizes three major general aspects. One, greater recognition and award to the champions. Instead of being an ultimate objective, this will be a stimulus in order to support achievements and to inspire best practices. This can be achieved through different actions. For example, the champions of malaria will be motivated and encouraged to continue implementing awarded activities and to continue with the recognized activities. The sustainability of the best practices and the epidemiological achievements will be very important for the countries awarded. The actions supported henceforth will be extremely valued by this initiative of Malaria Champions. In the concept note, we also considered to extend the periods of the activities recognized. The recognition of activities on a longer term, which will encourage a more consistent implementation of these national strategies and a greater commitment by local stakeholders, governments, interested parties in general in the fight against malaria. Now, with references or as references in the fight against malaria, we propose to maintain attention on these champions. And this will be done through incentives such as inviting champions to participate in the planning of future championships, to invite champions to bear the flame, to deliver the award to the new champions, amongst other things. And finally, to support the achievements of those awarded, the recognitions will be celebrated beyond this Malaria Day in the Americas. The promotion of the achievements by the champions will be extended throughout the year, and it will be done through different communication channels as well as advocacy channels. This implies, besides the distribution of communication materials, the dissemination of information through national and international workshops, technical forum, advocacy days, national or regional networks, local and regional magazines, scientific societies and congresses, as well as also through a more active use of social media. The second general aspect.
The Champions Committee of the Malaria has been recognizing simultaneously more than one champion, proposing in this updated conceptual note to continue granting several awards a year, recognizing now the different types or topics of the champions themselves. The recognition will not necessarily be a competition between the groups, but a documentation and recognition process of the efforts and the work. The objective here will be to highlight good practices that can be copied in the region, while at the same time we encourage those who are facing the greatest challenges. This initiative of Malaria Champions will continue to evaluate all entities, countries, provinces, municipalities, etc., for the implementation of best practices which must be recognized. It will also seek to recognize the contributions of non-government organizations such as communities, civil society, private or public initiatives, projects, research, academic institutions, etc., highlighting their efforts in malaria elimination and encouraging their search for success. The Champions Committee of Malaria will periodically review the models of good practices to be promoted, especially those that overcome bottlenecks that prevent the malaria elimination in the region. In Annex 1 of the conceptual note, which is published on our webpage, we find a list of themes discussed during the consultation with the countries, particularly themes related to solutions of the barriers to timely access to treatment, diagnosis, self-medication problems and possible effects, vector control, social determinants, financing, policies, and so forth. One of the most relevant aspects of the update of this conceptual note is related to the active mistake of the countries in organizing the malaria champions in the Americas. This participation will take place through the documenting of successful experiences in the fight against malaria in the countries by the health ministries. And for this exercise, it is expected that the countries make use of the epidemiologic and programmatic evidence for their documentation. The initiative Malaria Champions will thus become a promotion mechanism for analysis and use of quality information by the malaria programs. This is clearly aligned with the surveillance strategy for malaria elimination as an intervention promoted by the Technical Global Strategy 2016-2030 and the Regional Plan for the Elimination of Malaria 2021-2025. Please note, as I mentioned, that the versions in Spanish and English of this conceptual note are published in our webpage of the PAHO for further information. And now, next steps which we are considering for the end of this year and in coordination with the Malaria Champions Committee of the Americas, PAHO will start an implementation process of the ideas in the conceptual note for the Malaria Champions Organization 2023. The convening for 2023 will be sent during the first quarter of next year, including the new elements to encourage the countries to play an important role in documenting the candidates' achievements. And in support of these national problems, we'll help them in any way we can. And in that same order of ideas, in 2023, we will begin the implementation of actions addressed to encourage sustainability of good practices recognized as one of the most important elements discussed during the reviewing process. We will also be consulting with the countries interested in organizing national championships to determine the type of support the Malaria Committee can offer them. And we will be recognizing the new champions according to this conceptual note during the celebration of the Malaria Day in the Americas in November of 2023. Thank you very much to all the members of the committee of the Malaria Champions for this reviewing process, and special gratitude to all the countries, national and regional partners for their participation in the consultation process to complete this conceptual note. Thank you all for your attention. Thank you very much, Dr. Alexander. And now we would like to hear from the countries who have participated in the process. We'd like to begin with Brazil, and we'd like to invite Dr. Elder Figueira, head of the Environmental Surveillance Department of the Surveillance Program in Amazons. Hello, how are you, Elder? Dr. Figueira, you have the floor. Thank you. Thank you, and good afternoon to all of you. Thank you to PAHO for this invitation. The meeting of Brazil has about 45% of the notifications of malaria in the country. In partnership with the Ministry of Health and the municipalities, we work in collaboration so that the malaria control can be done in the region. The Health Surveillance Foundation and the Amazon municipality have already been recognized by PAHO and awarded with the Champions Award in the Americas in 5 times, 2010, 2017, 2018, 2019, and 2020. To be recognized by PAHO is always a satisfaction, and it has a very important political weight, since to maintain the malaria control on the agenda of the health authorities is a challenge, and the financial resources and human resources are always insufficient to maintain all the needs of the Amazon population. With the award, we have the responsibility of maintaining the commitment of malaria control in these municipalities. While we've observed that some of the centers that have received the award for malaria as an award for the objective achieved. And the fact is that they consider that the transmission of malaria in the territory is a problem that's already been resolved. But we have to consider that there are weaknesses and that it must be controlled if the award were given not only for those who have reduced the cases of malaria in their territory in a given period of time, but that they give it to those who manage to maintain or give the sustainability required, not allowing for the cases of malaria to return to the territory with sometimes higher numbers than even before the award. We suggest that the award be given when the elimination is maintained for at least 3 years, and when the reduction is maintained for at least 3 years, and when they reach the elimination, and so that they avoid the transmission of malaria with the adequate surveillance. We suggest that these strategies that seek to eliminate the Plasmodium falciparum be awarded. This continues to be a problem in the Amazon region, and it would seem to be a growing challenge. And there are matters related to fight against the transmission of malaria, such as the garito and indigenous areas. We think that this new scenario is a challenge for the elimination of malaria. We must strengthen the surveillance and maintain the investment. It's only with that type of change in our understanding and facing the situation of malaria is that we will, in fact, in the Amazon region, be able to be true champions in malaria control, not only in Brazil, but in all of America. Thank you very much. Thank you very much for your words, Elder. And I'd now like to invite Dr. Holvin Gutierrez, National Coordinator of Malaria and RNEI from the Health Ministry of Nicaragua, to hear his words. Dr. Gutierrez, welcome. Thank you for this invitation to this important event. And I also want to thank the Pan American Health Organization for this invitation in particular. We, as Nicaragua, also had a chance to win the award. And it's important to recognize all the efforts we made and all countries have made. As we've seen, the challenge of malaria elimination is indispensable, requiring the participation of different actors in the intervention of this disease. We must ensure sustained actions with adequate resources so that we can truly achieve the success of this goal. The different actors must be responsible, not only in the health sector. That's why the new approach is appropriate with the continuous technical support that we constantly receive from PAHO. This aperture is a space where we can report on the key actions that may generate change in our fight against malaria, with an automation and continuance of activities in our fight against malaria, which generates a positive impact in the short or medium term. And this will also help us achieve the documentation of the processes, recognizing the progress attained by all the countries that participate actively in the national territory, highlighting the inclusion in the award of the community affected, academia, the community, the private sector, civil society, all have shown true interest in this harmonization of actions that will help eliminate this disease. It's also important to recognize the strategy in different contexts and scenarios, which will help us achieve the collective or personal encouragement to the winners. It's very gratifying to continue in the process. Also, it's interesting to be able to develop these championships within the countries themselves. I think that would help recognize all the actors participating in this fight locally. It is an honor for me to report that in Nicaragua, we have managed to reduce the case of malaria significantly in recent years, though we know that our country is the largest in the number of cases in the region in the Americas, and we have managed to reduce more than 35% of the cases vis-a-vis years past. And just my gratitude to all of you for this space, and congratulations for this tremendous effort that you're doing, and for all the motivation generated to encourage the actors to achieve our goal of malaria elimination. Thank you very much. Thank you very much for your words, Dr. Holvin. And now I'd like to invite Dr. Keila Ureña from the Control and Prevention Center of Communicable Diseases, Vector Communicable Diseases of the Public Health Ministry of the Dominican Republic. Dr. Keila. Thank you, Dr. Patricia, and greetings to all of you. And thank you for this opportunity. I will keep my camera off because the internet is rather slow. But in considering the proposal of reviewing the champion malaria in the Americas, I'd like to remind you that in the malaria programs in the Americas, we've gone through different times or stages. One of them is the phase of change of the elimination where the country showed a great deal of enthusiasm since they all quite positively assumed the challenge and commitment of not only controlling malaria, but considered the possibility of zero malaria in the territory. However, the stage we're living in now, this period in which we're trying to achieve the so-called elimination goal, has made us realize the enormous challenges that this means. In most contexts, it goes far beyond just the reduction in number of cases. It's also made us reaffirm and confirm that there's greater need of involvement by the leading entities in the country. It's not just a single action in time. As we know, since the beginning of the Malaria Champions Initiative in the Americas, important and valuable efforts have been recognized from the different countries, who've contributed significantly with their own goals and those of the region. However, unfortunately, many of these have not been able to go beyond the simple honor or celebration. Hence, we believe that this review would be the motor or the starting point to guarantee the sustainability of every effort and achievement attained in the programs, achievements which are necessary and must last and maintain in time, since the elimination of malaria is based on a certification process where we have to document that the local transmission has been interrupted and that they're completely prepared to ensure this. And this will only be possible if we're really able to maintain all the actions and strategies that at some point have or are being planned and maintain them in time. From what I've said, we have to make an effort to recognize more sustainable efforts. That would create the necessary scenario and maintain the enthusiasm alive so that these strategies can remain in time and can ensure that the commitment for malaria investment by local governments will be permanent. Another important aspect to consider is that we should consider more than one topic or more than one champion. That will encourage us because we realize that the efforts we're making are valuable regardless of the challenges, and that it's something that we can report. And it will also encourage more people to participate and make us understand that there's no reason to stop, that we have to continue and will maintain the sustainability of the partners who are committed to malaria elimination. And lastly, we believe that this recognition of duly documented experiences will not only be the way to disseminate these successful experiences and the success of the program, it'll be a way to help the countries establish the necessary mechanisms to prepare the necessary documentation, which will have to be prepared further on to obtain the certification. So thank you very much. Thank you very much, Kayla, for your words. And we'd now like to invite Dr. Alexander for comments. Dr. Alexander, you have any comments? Thank you, Patty. And thank you to Drs. Figueira, Gutierrez, and Lloreña for your welcomed comments. The updated conceptual note that I just presented refers precisely to the situation in Brazil that was mentioned by Dr. Figueira, promoting precisely that idea of using the initiative as an encouragement to sustain the achievements and not just an end in itself. It also promotes the idea of awarding in long term for a more consistent implementation of the national strategies with greater commitment of local actors in the fight against malaria. This is also in line with the comment made by Dr. Ureña of setting on a greater sustainability of the programs that have been recognized and awarded. Dr. Gutierrez also referred to the need for the countries to take ownership of these champion efforts with greater commitment from the countries and greater involvement from the local actors, which undoubtedly goes hand in hand with the role of national programs supporting the Malaria Champions Organization in Americas with the necessary documentation of their experiences with the idea promoted by this conceptual note. And we're going to maintain an open line of communication with the country so that we can report our steps in time in the implementation of the conceptual note. The first contacts we've made will be to start a discussion regarding the process of documentation of experiences, which will feed into the Malaria Champions Organization of the Americas. Thank you very much to all of you. Thank you, Dr. Alexander. And we're getting now close to the end of the forum, celebrating the 16th Malaria Day of the Americas. Though this year there was no competition to select a champion, we've felt it would be timely to recognize the success by Belize. They have achieved the goal of zero malaria since 2019.
What can I say about Belize? I just can say that we wish to end this forum with a short video on how Belize Ministry of Health and Wellness Vector Control Program is working to maintain zero malaria and to become the next country in the Americas to be certified malaria-free by WHO. And I'm glad to see here the leadership of the Vector Control, Mr. Kim Bautista, also participating on the forum. This video is for you, Belize.
In the late 80s, we had malaria in the thousands. It has been a constant decrease up to now that we have reached elimination phase.
It is a very proud time for us in Belize to say that we've had zero cases since December 2018.
Ha estado bien duro, bastante trabajo, pero gracias a Dios lo hemos logrado.
For our country, it's a great achievement. I must thank our people who have made this possible.
Whether it be through mobile clinics, whether it be through the malaria program, through voluntary collaborators, through community health workers, the ministry has always had a presence.
We were just like sharks, piranhas. The moment we hear about a case, so we go immediately and attack it.
To reach here, it's not just the government, it's not just the program, but it's a unified effort, the input from everybody and all the stakeholders.
We plan to continue to work hard and try to target as much fever case as possible to stay malaria-free.
Cases that we've had during or that last 3 years up to now has always been imported cases, and these cases were detected early and treated. Definitely a whole investigation occurred, and this was all thanks to the surveillance system that we have set up in our country.
We have different organizations that can come together and we can contribute to keep this zero cases of malaria here in Belize.
What we need to do is not let down our guards and be able to continue the good work that has been happening.
I believe that what we're seeing currently is a testament to the arduous work, the commitment, and also the resilience of our people.
This is a significant achievement for Belize, and maintaining zero case for malaria is helping to reduce the impact on our people's health.
Here in Belize, with all the difficulties we have and the challenges we have, it's our hearts that keep us driving to keep our people safe.
We are, as a country, committed to ensure that we can keep Belize malaria-free. We now need to ensure that the entire region is also malaria-free.
This is the achievement of a champion. Congratulations to Belize for maintaining a zero malaria status for the last 3 years. And good luck on the country's application for certification by WHO as malaria free. Muchas gracias a todos los que han
Thank you all
participado.
very much for participating in this forum. Have a great Malaria Day in the Americas, and we'll see you next year when we will hear from our new champions. Thank you all.
Recording stopped. Recording in progress. Recording stopped.